Not surprisingly, when you've undergone an experience like cancer treatment, physical side effects often occur. Knowing that these things might occur is very helpful. I think one of the most common one is fatigue. Area of great deal of study, trying to understand what some of the biological determinants are. It's not linked to any one cancer or any one form of treatment. One of the other side effects of treatment are changes in the skin. And you know, everything from kind of very minor skin changes that might be due to a little redness related to radiation, to actually more major things that were related to scarring and how the scar healed. Osteoporosis, loss of calcium in bone, increases fracture risk. Fortunately, it's not a painful condition, but there may be medications that can mitigate that fracture risk. Lymphedema is swelling of the arm that occurs if there's any sort of surgical effect or even radiation effect on lymph nodes, because they kind of help drain that fluid out of the arm. There are strategies to deal with lymphedema, and we've made so much progress through physical therapy, various garments and wraps, knowing how to manage, prevent, and treat lymphedema. It's not as big a problem as it once was, but it hasn't gone away either. Certain forms of chemotherapy can damage nerves and cause neuropathy, a form of nerve pain or nerve numbness or tingling that may persist for quite some time, in some cases even permanent. Good news, there are meds that can manage that. Some forms of therapy are associated with changes in thinking, changes in ability to concentrate, cognitive dysfunction. There are rehabilitation services that are being used, neuropsychologists who are specialized in helping people do exercises to kind of get their concentration and thinking back. You know, when you're going through a cancer experience, your sex drive, your interest in intimacy is reduced. How you feel about relationships may change. I think most cancer care teams and most primary care doctors are doing a better and better job at mentioning it, but everyone should feel very comfortable bringing up the topic. Most cancer survivors don't have pain, but again, depending on the type of cancer you had, the type of treatments you had, you may experience some pain. So we've increasingly recognized the importance of physical therapy and occupational therapy for the cancer survivor. We often link physical therapy and occupational therapy. They're different. Physical therapy is how you kind of use your motor functions and sensory functions. Occupational therapy is kind of how you function, how you use the physical function to do your activities of daily living. When I talk to cancer survivors and they talk about their whole experience, it's not unusual that I'll hear about, you know, the most helpful thing was that they sent me to physical therapy and occupational, and I didn't think I would even need it. Some of us just kind of accept that, well, I've lost some function here and I just can't do what I used to do. They actually can get some substantial function back, and in some cases learn how to do some things with less pain. For the majority of cancer patients, physical functioning gets better and better. So you can't judge the success in 3 months or 6 months or a year, but 2 years, 3 years, 4 years, the path is usually a very positive one. If things are not the way you want, you may be assuming that there's nothing that can be done. Often there is.